Good day, fellow learners. Once again, this is the mentor, your fact check buddy, Ray Gapuz, joining you for our discussion for case number 48. And this is with regard to your preparation for your next generation NCLEX RN test. Okay, so for this session, we'll be talking about depression and Parkinson's disease and how these two conditions would usually manifest in a specific patient. But before we begin, may I ask you to join us in this mission? Our goal is to provide free NCLEX RN application and review to 500 nurses. And to help us achieve this, just watch and finish the ads in our videos. We've increased our quota. We started the 100 nurses a couple of years back. We increased that to 300, and now we have progressively been increasing it so that we can change more lives in terms of our colleagues, especially in the countrysides. So if you share this video to at least 10 of your friends, we'll pray for your success. So thank you so much for doing that in advance. Before we move on to our discussions, let me say congratulations to Ms. Hershey B. Dupiawan, USRN from Baguio Central University, who passed the next generation NCLEX RN for the State Board of New York. Congratulations, and she passed the test last August 12, 2025. Let's learn from her success recipe because she admitted that she graduated a long time ago, and the combination of tools and test preparation programs that she had with our system enabled her to pass the test with confidence. So here's her success recipe. Proverbs 3 Verse 5, trust in the Lord with all your heart and lean not on your own understanding. Thank you, Heavenly Father, for guiding me during the full period of my NCLEX journey. Yaman Sir Ray and the RAGRS team for imparting your knowledge, skills, and expertise. It took me a year to complete the NCLEX journey because I graduated many years ago and I know knowledge deficit applies to me. It was not easy because I was balancing between reviewing and taking care of my children, but God always makes his way. I attended four, take note of that, four comprehensive review programs. You don't have to pay additional for that. Our review is unlimited. 4 boot camps and 2 quick fixes. What a journey it has been. Indeed. Okay, it's like a song. What a journey it has been. Okay. The functional concepts, that's the core of our teaching and learning strategy here at the Ray Gapuz system. That is a trademark of the system, and people who are not trained on that, they don't know how to do it, okay? Think first strategy, another trademark strategy of the Ray Gapuz system, including Think Syndromic and Go Slow, has helped me recall all that I learned in the review. My patience, perseverance, and hard work paid off. Most of all, trusting the Lord and letting his will be done has resulted in this exceptional blessing that I will be forever grateful. To my family, I wouldn't have been able to accomplish this without your support, understanding, and most especially your love. To my fellow colleagues, believe that you can, pray hard, trust the system, and claim I am next. Again, kudos to you and Dr. Ray Gapuz. Hershey B. Dupiawan. Thank you very much for the very kind words, Hershey. What a way to prepare for the NGN. And that is approximately a combination of 3 programs, and you in total attended 10 separate and different schedules. Excellent preparation. What a dedication. My hat's off to you. Okay, congratulations once again, Hershey P. Dupiawan, USRN of Baguio Central University. And some of you who might be thinking about a more cost-effective way of preparing for the NCLEX, you may want to purchase a copy of my book, NCLEX 311. And if you would want to attend my QUICKFIX session, it comes with the NCLEX 311 and 2 other books, Pharmacology and Nursing Reminder Sheets. So you have 3 books plus 24 hours with me in the QUICKFIX session. So what they're saying, parang actual. It looks like the actual test. Parang reflection po talaga, sir, of the QUICKFIX YouTube and 311 yung questions that I got. So happy I got through the exam successfully. Thank you po, sir, ng marami. Then Chin says, blank also came out. I was like, Sir Ray, know what topics would come out? I'm glad I'm a Gapuz baby. And Vic says, sincerely speaking, if it were not for NCLEX 311, I would not have passed. Went through in the last 4 days of the exam. That book is amazing. Keep up the good thing of helping us nurses. NCLEX 311, it's the best. And this is what they say, halos same na same po siya sa pagkakakonstruct sa mga na-encounter ko pong mga standalone questions. Legit. In other words, what they're saying is the way how the questions were constructed in the book reflects that of the actual test experience of the test taker. So thank you very much for trusting our system. Now on to our case number 48. We're going to talk about depression and Parkinson's disease. A lot of people are asking, which comes first? Is it depression or Parkinson's disease, or the other way around? Parkinson's disease before depression? Well, the answer to that question is both. Sometimes depression could be the initial manifestation of Parkinson's disease, and sometimes in some other patients, Parkinson's disease develops first, and then since the condition is chronic, eventually depression results. Okay? So whether it occurs before or after, depression occurs with Parkinson's disease. That's our first functional concept. Here we go. So when we speak of functional concepts, it could be a word, a sentence, a phrase, or even an entire paragraph that gives your mind a set of rules that you can use when you deconstruct the question. Okay? In essence, a functional concept is both a content and a test strategy. So let's begin with our first functional concept. Parkinson's disease involves degeneration of dopamine-producing neurons in the substantia nigra, that's in the brain, as well as the serotonin and norepinephrine pathways, which are crucial for regulating mood. So if we're going to take a look at the progression of the pathophysiological changes that occurs in Parkinson's disease, it begins with the neurodegeneration in the brain, specifically the limbic structures. Now, when we speak of the limbic structures, that could include the hypothalamus, which has a role in our emotional response, the basal ganglia, which is responsible for both movement and motivation, as well as the amygdala, which is also responsible for our emotional response. So in essence, the parts of the brain that are affected in Parkinson's disease have specific effects on both mood and movement. So that, as you get to see in the picture that we have here, the image, you see the signs and symptoms of Parkinson's disease: stoop posture, masked face or expressionless face, back rigidity, and the forward tilt of the trunk, so that when the patient moves, it's like a propulsion or propulsive gait. You have the flexed elbows and wrists that usually doesn't swing when they move around, reduced arm swinging, the resting or hand tremors, which may occur unilaterally, meaning it would initially affect one arm and then eventually it affects both arms, so it becomes bilateral. And then you have tremors in the legs and slightly flexed hip and knees. And of course, shuffling, short, and step gait that increases the risk of the patient for falls. All of this because of the neurodegeneration changes in the brain, specifically the limbic structures. Okay, and then from there, there's going to be a decrease in dopamine, serotonin, and norepinephrine, which would definitely impact the mood of the patient, and that leads to depression. And so, depression may initially be one of the earliest manifestations of Parkinson's disease. So that's how it could potentially progress. Although sometimes depression comes after the diagnosis of Parkinson's disease. Now, depression in Parkinson's disease is a part of the disease process itself, which means it is not something that just develops. It is something after the disease or after the initial diagnosis, but it is something that is the after effect of the neurodegeneration in some parts of the brain. So it's also important, therefore, that we need to always screen Parkinson's disease patients from non-motor symptoms like depression, anxiety, sleep problems, and constipation, because they may appear earlier than the motor signs of Parkinson's disease. So speaking of the motor signs of Parkinson's disease, what are these? Now remember our acrostic bad deaths. Once again, this is a copyrighted material. If you want to use it, go ahead, but please do cite where you got it. So the first one, let's talk about the B in the word bad. That's bradykinesia or slowed motor movement. And then A, absence of arm swinging when walking. And then D, drooling. D, difficulty swallowing and speaking. So that increases the risk of the patient for aspiration. And then the client is excessively clumsy. So you see clumsiness in a patient with Parkinson's disease. And eventually they develop bowel and bladder incontinence that could tell us that the patient is in the later stage of the condition. And of course, your pill rolling or resting tremors that initially occurs unilaterally and then it becomes bilateral. And speech abnormalities like slurring. Some patients, because of the depression, may have monotonous speech. Okay, so remember, bad deaths. Now, antidepressants alone may not fully work for depression associated with Parkinson's disease. So which drug is usually given? You have your pramipexole, which is a drug that increases the dopamine levels in the brain. So if a Parkinson's patient presents with depression plus apathy or anhedonia, anhedonia means loss of interest in pleasurable things, including sex or hugging or touching or kissing, your pramipexole may be considered since it addresses both the motor and the mood symptoms of Parkinson's disease by targeting the dopamine pathway. So in essence, a prolonged use of pramipexole eventually would have the potential of increasing your dopamine. But the problem when you have increased dopamine is that the positive symptoms of increased dopamine levels that are associated with schizophrenia may manifest, like delusions, hallucinations, looseness of associations could develop in the patient who's taking this drug. So pramipexole is a dopamine agonist, meaning it stimulates dopamine receptors directly. And I'd like to highlight two important things that you need to remember. First, your pramipexole should not be given with amitriptyline. Amitriptyline is a tricyclic antidepressant, and if it is combined with your pramipexole, the amitriptyline will definitely worsen the sedative effects of pramipexole. Next important thing that you have to remember, if your patient is being given pramipexole, assess the patient for signs and symptoms of increased dopamine levels, and that includes your delusions and hallucinations. So remember the 3S for the side effects of pramipexole: sleep attacks, shopping, sexual or gambling compulsion. So they become hypersexual, or they have like manifestations of a hypermanic state, like excessive shopping and excessive gambling, and then eventually they develop swelling or edema. Now, anticholinergic side effects like nausea, vomiting, constipation, orthostatic hypotension may also develop in a patient who's taking pramipexole. So before we try to use what we just discussed in answering a specific case study, let me first say, once again, congratulations to the world's oldest NGN passer in the person of Miss Flor Villarreal. Okay, from Agro Foundation College in Mega City. She passed the test on December 2, 2024. So here we go. Case number 48. Patient profile, Mr. Anthony Cruz, 58-year-old male, married, retired accountant 3 years ago. Antonio, as he is called by his wife, presented to his primary care physician with low mood, fatigue, loss of interest in habits, and poor concentration, including a report of sleep disturbances, difficulty initiating activities, and reduced appetite. All of these are manifestations of, you have the diagnosis, major depressive disorder. He was started on selective serotonin reuptake inhibitor. Now let's try to figure things out if this is indeed just major depressive disorder or depression associated with Parkinson's disease. In which case, if it is depression that comes with Parkinson's disease, your SSRI alone would not work. On assessment, the patient manifests masked faces or reduced facial expression, bradykinesia, slowness in initiating movement, cogwheel rigidity in the right upper limb, meaning very rigid muscles, mild resting tremor in the right hand. Now, so the 62-year-old patient, here's a simple question. Parkinson's disease is prescribed pramipexole. The nurse is teaching about the expected effects of this medication. Which of the following symptoms may decrease with pramipexole therapy? Select all that apply. Now, what the question is asking is, which symptoms may decrease? We learned a while back through our functional concepts that your pramipexole would address both the motor and the mood disturbances that comes with depression associated with Parkinson's disease. So definitely, will it address bradykinesia? Yes, that's a motor abnormality associated with Parkinson's disease. Resting tremor? Yes. Muscle rigidity? Once again, yes. Hallucinations? No. Okay. Hallucinations will increase. The question is asking which symptoms may decrease, because as I said a while back, your pramipexole may potentially increase dopamine, and comes with the increase of dopamine would be the symptoms associated with the positive manifestations of schizophrenia that includes delusions and hallucinations. So 4 is a part of the correct answers. And anhedonia, loss of pleasure or motivation, or lack of interest in pleasurable things like touch, okay, cuddling, okay, or even sex. So the answers therefore are 1, 2, 3, and 5, except hallucination. So these are your correct answers. So I just hope you learned from today's session. So I'd like to invite you to use our simulation room for the NGN. That's the only one in the world. We have a new tool that facilitates learning through our simulation of the NGN. It feels like the real thing. Okay. So visit us also here at the RA Gapuz Review Centrum here at the United Nations Avenue in Manila, Philippines. This is where we conduct our QUICKFIX sessions, and this is our main hall where we conduct larger classes. And of course, we have very comfortable restrooms and students lounge. Okay, so see us here at the Ray A. Gapuz Centrum here at United Nations Avenue, Manila, Philippines. For those who may want to avail of our programs, you can do so online. Okay, please do like and subscribe to our YouTube channel. We're now closing in to 29,000. So I just hope you can share our site to your friends so they would be able to learn more from our videos. So we also have our promo, get a free review from us if you process your NCLEX RN application with ITAPS Gapuz, our processing partner. So once again, get a next-gen NCLEX review for free if you process your application with us. So once again, this is your mentor, your fact check buddy Ray Gapuz at your service. For those who are taking the test in the next few days, good luck. Break a leg, and remember, one functional concept a day keeps your NCLEX RN fears away. So take care, and God bless you in your test.